Hello, my name is Dr. Sandra Hardee, and I'm the medical director at Prisma Health for the Department of Occupational Health Services. Going to do another video this month, short video this time, talking about shift work and how it affects the body and how someone can kind of prepare if they're working non-traditional work hours. And I always welcome folks if they'd like to, they can email me any questions that they have about it. So shift work, the way shift work is defined is typically it's just anyone who works non-traditional work hours. So non-traditional work hours are basically 8 to 5. So people that work second shift, typically 3 to 11, or third shift, 11 to 7. It may vary depending if it's a 12-hour shift, like firefighters typically work at 24 hours on, 48 hours off. So there's a lot of different shifts that fall into this category. But according to statistics, about 16% of the workforce works non-traditional hours. So that's about 22 million employees in the U.S. And about 8 million of those work what we consider a night shift. So we don't talk about this too much, but working non-traditional shifts can have a lot of impact on our body, and that's because our body is designed hormonally to have a circadian rhythm, to have a time where when the sun comes up and that time of the circadian 24-hour rhythm, certain processes in the body start to work to get us alert and active, and then vice versa in the evening. When we should be sleeping, it's dark and our body has time to rest and restore. So, for people who do work non traditional hours, there's some common symptoms around that. So, obviously, there's a lot of sleep issues. So, insomnia, sleep apnea, restless leg syndrome can be an issue. There are folks that have a lot of gastrointestinal issues, such as constipation, bloating, indigestion. Partly that's because they may eat differently than a normal during the daytime hour. They may snack more or skip meals, which can have an impact. But also looking at chronic problems that people can have related to this, such as obesity, diabetes, mood disorders like depression, anxiety, irritability, fatigue, and then some very, very serious issues such as heart disease. And there is a correlation with some types of cancer. So if you look at this slide, this sort of tells you by body organ systems, some of the different symptoms that folks can have. You can see the slide there as it outlines some of the things that I mentioned before. There is a medical diagnosis called shift work sleep disorder, SWSD. So if you take all those folks who work non-traditional hours, about 10 or 40% of those are diagnosed with SWSD, but they just do not acclimate over time. Most people, after a period of time, can acclimate to the change in this shift work, but some cannot. And the two main symptoms that they will describe to their physician is insomnia, inability to sleep, and then hypersomnia, meaning they're very sleepy when they should be awake. Additionally, they can complain of issues with difficulty concentrating, headaches, lack of energy, again, some mood disorder symptoms such as irritability, difficulty thinking through processes. And the treatment for these can include things such as light therapy, sleep aids or sleep medications, melatonin supplements, changing your routine, and also work promoting agents. So something that we get asked occasionally by an employee is, if I'm doing shift work, how can I prepare myself for this? So typically, if you are going to begin for the first time shift work, you want to gradually shift your hours, stay up later, wake up earlier, those kind of things to get you used to that. Once you are working the non-traditional shift, you want to stick with those hours, even when you're not working. So on the weekends, if you typically are up at night and asleep during the day, it's best to stick uh, with that routine. It's also important that you put more energy and effort into sleeping. So, how do you prepare your room for sleep? You want it very dark. You might want some room darkening blinds. You might want to wear eye shades. You want to make sure the room is very cool. You want to avoid TV. You want to turn your phone off. You don't want any light in that room. Some people will wear earplugs to reduce noise. Some folks will put a sign on the door in their home, telling them, don't disturb. Anything you can do to help so it's easier for you to get rest during the day. It's also, though, important that people continue to get routine exercise, so at least 30 minutes of exercise 5 days a week. Again, we don't recommend exercising before bedtime. That interferes you getting into a calm, slow kind of relaxed state in order to sleep. It is very important to avoid caffeine and energy drinks before bedtime. Um, you don't want to go to bed feeling hungry. That's what some people do. You want to have maybe a light meal or snack before sleeping. And it's always good under any circumstance, but particularly for shift work, is that you're trying to eat a healthy meals and on a regular basis. The final note I'll add, should avoid alcohol. Alcohol affects our ability to enter into REM sleep. Alcohol may help you fall asleep, but you typically will wake up shortly thereafter. Also, we counsel people to stop smoking if possible. Nicotine can act as a stimulant and make sleeping more challenging. The next slide is just a little funny joke. I finally got 8 hours of sleep, but it took me 4 days, but whatever. So, yes, it can be challenging for people who are working shift work. It's not for everybody. I meet employees who work third shift and they have done it all their life and they are acclimated to it, and it doesn't seem to have any deleterious effects on them, and that's fine. But others, it can be a challenge. This slide, I've just highlighted 3 links. Occupational health services falls under a larger umbrella at Prisma Health under employer health services, where we offer wellness services. We offer episodic care and on-site clinics for your businesses. And we also now have a direct primary care office in the upstate that some businesses may be able to benefit from. So there is some links there to those topics that I just mentioned. And there's my final slide. So this one was a short one, but I hope it's been beneficial. Again, I appreciate your time and thank you for listening.